Folks, this is Dr. Graham here today at the Daily Dentist. And today we're talking about gum disease. Gum disease is basically can be categorized in two different categories. The first type of gum disease is what we call gingivitis. And gingivitis is basically an infection or inflammation of the gums only. And gingivitis can easily be treated and getting rid of, and you have healthy gums. Usually get the teeth cleaned up really well, get the patient proper brushing and flossing and good oral hygiene instructions. Gingivitis will be gone in 2 weeks. And then the teeth can be nice and healthy. This is a picture of showing nice and healthy gum tissues. You can see how the gum tissues are nice and pink and stippled, or kind of have the orange peel reflection on it. Those are nice, healthy gum tissues. If gingivitis is not treated, then gingivitis can progress to the next gum disease we call periodontitis. Periodontitis is when you have an infection of the bone or supporting structures. Periodontitis is when the bone structure is being lost due to a lot of bacterial waste, bacterial toxins that build up beneath the gums. And when that occurs, the teeth can start to get loose. You may start to get more spaces between your teeth. When you lose bone, you cannot grow bone back around the teeth. But if it's treated properly, you can stop periodontitis or bone loss right to the level where it occurred, and you don't have to lose more. But that is done by proper brushing and flossing and having your teeth cleaned on a regular basis. As we talked about in the earlier clips where we talked about proper brushing and flossing, those can prevent gum disease. Again, this image here shows nice, healthy gums. If you start getting gingivitis can start to turn out to where you have other issues like we have on this here card here. It's showing in this area where you can have little inflammation starts around the gum tissues, right at the neck of the teeth, little red highlights. And as those go and they're not treated properly, it can progress. And as you see each image, it gets worse and worse as we go. With more gum disease, eventually it starts to affect the bone. As you can see, you start to get spaces between the teeth, which is different from here. Get more spaces between the teeth, eventually more gum disease, gingivitis, more spaces, and you end up losing the teeth. And as we show here, down here at the bottom, this is showing on the x-ray, is when you have nice healthy bone levels. And as it gets worse and progress, you get more bone loss, eventually till you start getting more spaces between the teeth and you end up losing the teeth. With gingivitis, like I said earlier, it can be treated and it can be stopped and you can continue to have healthy gums. But periodontitis, when you start losing the bone, as we were showing here earlier, we can do gum treatment on it to stop the periodontitis from progressing, but the bone loss that you already have, you can never get that back. But you don't have to progress till you get some of the later stages where you end up losing your teeth. And so when you go to the dentist and they do a checkup on your teeth and do an exam on you, we like to do the proper exam is do an exam on your gum tissues where you do what we call probing. Probing is when you take a little instrument that you see up here and you gently stick it below the gum tissues and you get measurements. And usually when we measure the measurements, usually numbers like 1, 2s, and 3s, those are healthy numbers. It means you have healthy gums. If you start getting to 4s, that means you have some early stages, or late stages rather, of gingivitis. 5, 6, 7, 8, 9, 10, those are stages where you have bone loss or periodontitis. Now we can have 1, 2s, and 3s, and if the dentist calls out bleeding with 1, 2s, and 3s, that means you have good healthy bone levels, but you have some early stages of bone loss because you have some bleeding. It's kind of like your check engine light coming on, as I used that example earlier, and you get the bleeding. It's kind of letting you know, okay, you have something going on with your gums. You need to get to your dentist to get it treated. If you don't get it treated, then it continues to progress to more severe gingivitis and ultimately to periodontitis or bone loss. So as you see in these areas here, once you start getting the bone loss and the teeth start spreading, the gum treatment becomes more expensive and you have to follow up more frequently with your dentist to get the treatment done. And you get on different types of gum treatment. With healthy gums, you can continue to get the teeth cleaned and you get your 6 months cleanings. Once you start getting periodontitis, bone loss, then you have to get the teeth cleaned more frequently. The reason for that is because as you get bone loss, you get what we call deeper pockets. And as those pockets are deeper, you have to go to your dentist and have those teeth cleaned more frequently because the pockets are deeper and they can easily get reinfected. And so usually your dentist or oral health care provider will put you on maybe a 3-month or 4-month recall to have the teeth cleaned or the gum treatment done to you to prevent the relapse of the gum disease or periodontitis. Once you get diagnosed with periodontitis or bone loss, you can never go back to the healthy mouth cleaning if you have the severe bone loss. You always have to get a little deeper cleaning involvement, which we call periodontal maintenance. And that's done so you can always get deeper below the gum line to help clean and remove the deposits that may build up. And so once you have that done, like I said, your cleanings can become more expensive and become more frequent visits at the dentist. So gum disease, like I said, it has 2 different stages. Gingivitis, which is the early stage that can be treated, easily taken care of, easily prevented. Once you get the teeth cleaned properly, you brush properly, you do your proper flossing or using a water pick, that can be taken care of and your gums can be back to the healthy stage. Once you start getting to periodontitis, especially the later stages of periodontitis, then that's when it involves more deeper gum treatment, more frequent visits to the dentist. But like I said, the early stages of periodontitis, that can be treated and it can prevent you from losing your teeth. One other thing I want to give you as far as overall health-wise, patients or people who have diabetes or exposed to diabetes, smokers, they have an increased risk of getting gum disease. And so if you have habits like that, you definitely want to make sure you're doing your proper brushing and flossing and oral hygiene needs because those can really make you more susceptible to getting gum disease. Those are things like diabetes, smoking. They can cause more problems for you to maintain your oral health. And so those are a few nuggets we want to give you today at the Daily Dentist, just speaking on gum disease. Thank you so much, and we'll see you next time.